I'm going to show you now how to perform the pump technique. This is another stroke from water techniques, MLD, manual lymph drainage. It is now performed with the entire hand. So we are going to have thumb and the fingers and the palm in contact with the skin. It will also have a perpendicular stroke. So my wrist is in flexion, little bit pronated, thumb and fingers in opposition, and I'm going to be perpendicular, again perpendicular to the collectors. Collectors are running this way. I'm going to be perpendicular to the collectors, and I'm going to do a perpendicular stroke that will be stretching the collectors down, full hand contact, and my directional stretch will push against towards the shoulder. This stroke, it's a full contact stroke. So my hand, it's entirely in contact with the skin, fingers, thumb, and palm, contact with the skin. And it is used for rounded surfaces. So I'm showing you the pumps for the lateral aspect of the upper arm. This will be my perpendicular stretch, directional stretch, resting face. My working face will be perpendicular stretch, directional stretch, resting face. And this is always dynamic. It is a dynamic stroke. You can perform pumps with one hand or bimanual, two hands. Perpendicular stretch, directional stretch, resting. Now we can also do pumps in the legs. So remember, pumps are for rounded surfaces. So we're going to put fingers and thumb opposite. You can do one hand or you can do bimanual. So I'm going to show you one hand first, perpendicular stretch, full contact, directional stretch. 1 second, each working face. Perpendicular, full contact, directional. And this is pumps for the anterior thigh. 1 second each working face, perpendicular, full contact, directional. Or you can also do bimanual pumps. So you're going to do one hand at a time. Perpendicular, directional, rest. And this will be a bimanual pumps on the anterior surface of the thigh. Keep in mind that the web space of the index and thumb is guiding you where you're going. And you're going to do alternating hands, one hand and then the other. The hand that's leading continues on top. Keep the hands close to the skin. And these are bimanual pumps. Now you can combine these two basic strokes that are called the pump and the stationary circles and make a combination of a stroke that start with the pump and continue with the stationary circles. This is called pump push. It's going from distal to proximal and it's doing one pump, one stationary circle. It's the most effective stroke in MLD. And they're both dynamic. You're going to use bimanual, two hands to do this stroke from distal to proximal, and I'm performing pump push on the forearm from wrist towards the elbow. Now remember, you have to keep your perpendicular and directional stretch perpendicular stretch, full hand contact, directional stretch, and perpendicular stretch, directional stretch, resting phase. So this is pump push on forearm from wrist towards the elbow. You can also do pump push in the upper arm. So we can also do pump push in the leg, rounded surfaces. So this is combination of a pump and stationary circles. The pump's always going to be first, then the stationary circle follows the pump. And the stationary circle is going to be performed where the pump left off at the web space. Thumb and finger, pump and stationary circles. This combination of stroke is called pump push. Pump, stationary circles. Remember to always do your perpendicular stretch and directional stretch. Perpendicular stretch, directional stretch. It is always a dynamic stroke. So you're going to need two hands free to do this stroke, combination of pump and stationary circles. I'm going to show you now how to perform the scoops and the forearm. This is the third basic stroke from Butter technique. There is basically 4 basic strokes: stationary circles, pump, scoops, and the rotary. These will be scoops on the forearm. Now all the strokes are basically performed in the same way with a perpendicular stretch and a directional stretch. In the case of the scoop, you're going to position your hand just like a pump. So fingers are opposed to the thumb, and this is for rounded surfaces. But now to do the scoops, we're going to, instead of going down into the skin, into the forearm, we're going to go around and stretch the skin of the opposite side that we are treating. And this will be our directional stretch. So this will be a perpendicular stretch, and this will be our directional stretch. This is a dynamic stroke as well, so we're going to move from distal to proximal. You can do that with one hand or the other, or you can also do it bimanually. One hand, perpendicular stretch, directional stretch. We're going to start on top, but we are actually going to be treating the back. These are scoops. And the scoops go from, in this case, anterior to posterior, treating the posterior. Now this is, again, a full contact stroke. So my hand is going to go around up to here, and from here on, my full hand is going to be in contact with the skin. Another full contact stroke for rounded surfaces. So we usually use it for forearm and lower legs. We can also do scoops in the lower leg, and it'll be the same way we did the arm. Fingers in opposition with the thumb. We're going to start on the anterior leg, but we are actually treating the back, the posterior leg. And we're also using the perpendicular stretch, full contact, directional stretch. So thumb in opposition with the fingers, the wrist is in flexion, and we're going to go around the leg, full contact, and directional stretch towards the knee. Now this is a dynamic stroke, and it also can be done by manual. So you're going to do one hand and then the other. This is scoops. So you see we start anterior, but we're actually treating the back of the leg, posterior leg. And remember 1/1000, 1 second per working phase. Now we can also do a combination of a pump and scoop. So we're going to do pump anterior, and where we did the pump, we're going to do scoop. Second pump from distal to proximal, from the ankle towards the knee. Third pump, and you notice I'm doing my scoop where I left off the pump. Remember, these strokes are performed 5 to 7 times. Pump and scoops. So we're treating the entire leg. These are both full contact strokes. The rotaries are going to be also a full contact stroke, but this time my fingers are going to be following the collectors. So in the back, we're going to have the sagittal watershed that is going to divide the two quadrants. The collectors are going to originate at the watershed, and they're going to run adjacent to each other towards the axilla. So now this time my hands are going to be following those collectors with a full contact stroke. So my thumb also in opposition with the fingers. I'm going to drop my hand on the ulnar side, and the thumb is going to go back and in for the perpendicular stretch and directional stretch, pushing towards the axilla. Then I'm going to leave the thumb in, stretching towards the tip of my fingers. And you want to go all the way down towards the axilla. Now this is usually a bimanual stroke, meaning you're going to use two hands, one at a time. You're going to do one rotary towards the axilla, and the second one towards the axilla. One second per working phase, all the way down towards the axilla. So I'm showing you how to do rotaries on the posterior trunk or the back. You can also do the rotaries on the chest. Same principle, following collectors from the sagittal watershed towards the axilla. You're going to go, your thumb will be opposite of that watershed in the opposite quadrant. Your fingers are going to be pointing towards where I'm going, which will be in this case the left axilla. And my other hand is going to be the same position. So you can do a perpendicular stretch, flat hand, directional stretch, perpendicular stretch, flat hand, directional stretch, underneath the breast. And this hand will go through the anterior axilloaxillary anastomosis from sagittal towards the axilla. So you can do that by manual, dynamic, one hand and then the other, alternating. Second hand, and it will maybe take you 3 hands to go all the way down towards the axilla. Now you will only do the rotary techniques on the chest towards the axilla of a healthy lymphatic system, towards the healthy lymph nodes, in this case left axilla. Now you can also do bimanual 2 rotary techniques to meet the IA, which is the inguinal axillary anastomosis, and from there do a combination with the dynamic stationary circles, and this we call the technique of 7, also done an unhealthy quadrant. It's a combination of the rotary technique with dynamic stationary circles. I'm going to show you stationary circles, and the way you perform stationary circles, it's using only the palmar surface of your fingers. You're not going to use the palm or the thumb, just from the MCPs to the tip of your fingers against the skin. Your fingers need to be positioned perpendicular to the collectors. In this case, the collectors originate at the watershed. They run towards the axillary lymph nodes. So I'm going to position my hands perpendicular to those collectors, and I'm going to perform stationary circles, which they're going to stay in the same position. I stretch and direct towards the axillary lymph nodes. And this will be stationary circles with the perpendicular stretch and the directional stretch. Now I'm going to move my hands, and I'm going to change this to dynamic stationary circles, which means now I'm going to alternate and move my hands from sagittal watershed towards axillary lymph nodes all the way to the axilla. And these are going to be dynamic stationary circles performed in the back. Now we're going to show stationary circles in the chest. So this is going to be bimanual, 2 hands, stationary circles on the chest, and this is performed in the AAA or AAA anastomosis on the chest from the sagittal towards the axillary lymph nodes. So if you're going to stay, we call it stationary circles. If we're going to move, now we call them dynamic stationary circles. Dynamic stationary circles are going to move from the sagittal watershed towards the axillary lymph nodes. You can also use your bimanual stationary circles in the lymph nodes to stimulate and activate lymph nodes. And those are going to stay in position. With every step, we're going to do 5 to 7 times. So we're going to stretch the collectors towards the table and deviate towards the axilla 5 to 7 times. And we're going to stay in the same place. This is the stationary circles, bimanual, because it's performed with 2 hands. Now we can also use the bimanual stationary circles to open anastomosis. So if we have the anterior axillary anastomosis and we're going to open the anastomosis, we need to put our 2 hands bimanual and do stationary circles on the anastomosis. To open the anastomosis has 3 steps. The first step is on the healthy side of that quadrant. We're going to go 5 to 7 times. Second step will be on the swollen side of the quadrant. My hands are parallel to the sagittal watershed. And the third step will go across the entire anastomosis from swollen towards healthy. Dynamic stationary circles. Remember, each step we're going to do 5 to 7 times. You can also perform stationary circles in rounded surfaces like the forearm. And these are called dynamic stationary circles. Bimanual because you use 2 hands, bimanual dynamic stationary circles. And we always go from distal to proximal. In this case will be from the wrist to the elbow. If we want to do the entire arm, we'll go dynamic stationary circles from the wrist, past the elbow, on the lateral aspect of the upper arm, all the way up to the shoulder. And these are basic stationary circles, dynamic, from distal to proximal. Now we will show you how to do dynamic stationary circles on the anterior aspect of the thigh. So these will still be basic techniques. Stationary circles are the most basic strokes in MLD. And it's going to be 2 steps. One will be this perpendicular stretch, directional stretch, and the resting phase. Perpendicular, directional, resting phase. Each stroke should last at least 1 second. Dynamic stationary circles performed on the anterior thigh. We can also do dynamic stationary circles on the anterior knee. And we'll do 3 steps below the knee, on top of the knee, and above the knee. Dynamic stationary circles. You can also do dynamic stationary circles on the lateral aspect of the thigh, and always from distal to proximal. Dynamic stationary circles. I'm going to show you now how to do thumb circles. Thumb circles are just going to be performed with your thumb, and it's going to follow the same principles of every basic stroke. So it will have 2 phases, the working phase and the resting phase, and the working phase will be a perpendicular stretch and a directional stretch. Your thumbs are going to be positioned perpendicular to the collectors. So the collectors in the foot are going to go up the leg. You need to put your thumb perpendicular to the collectors. So my perpendicular stretch will be my entire thumb in contact with the skin, and I'm just going to stretch towards the tip of my thumb until I cannot stretch anymore. That will be your perpendicular stretch. Now the directional stretch, my wrist goes down and I'm going to send the fluid up. So will be a perpendicular directional stretch and resting face, pivot my thumb and do it again. So these will be thumb circles. Now you can do 2 tracks to cover the entire dorsum of the foot. So will be 1 perpendicular directional rest, perpendicular directional rest. And the movement comes from my wrist. So I'm going to bring my wrist down and my thumb goes into a deduction. You can do thumb circles for small surfaces. And this will be from the lymphatic lake towards the ankle. We call the lymphatic lake where the foot meets the toes. And this is thumb circles. These are going to be dynamic towards the ankle. We can also do thumb circles in the dorsum of the hand, starting at the knuckles and towards the wrist, to the styloid process of the wrist. So we are going to do the same thing we did in the foot. We're going to do the perpendicular stretch, directional stretch, resting face, perpendicular stretch, directional stretch, resting face. So we could do this dynamic and bimanual. So we'll do 2 tracks, perpendicular directional from knuckles towards the wrist, always from distal to proximal. And we always do 5 to 7 rows, 1 second working face.
Manual lymph drainage, MLD, is a gentle manual treatment technique that's based on the 4 basic Vater strokes: the stationary circle, pump, scoop, and rotary. Stationary circles can be used on any part of the body, while some strokes are used for specific parts of the body, such as flat surfaces, back or chest, or rounded surfaces, arms or legs. Also, a combination of these strokes can be used to increase effectiveness, such as pump with stationary circle, which is referred to as pump push. Strokes are performed either in a stationary pattern, remaining in the same position, or in a dynamic pattern, which involves movement of the hands towards a specific location. Strokes are performed using one hand or bimanually using both hands. The goal of manual lymph drainage is to reroute the lymph flow around blocked areas into more centrally located, healthy lymph vessels which drain into the venous system. The common denominator in all strokes is the working phase and the resting phase. In the working phase of a stroke, stretch stimuli are applied to the subcutaneous tissues, resulting in the manipulation of anchoring filaments of lymph capillaries and the smooth musculature in the wall of lymph angions. The light directional pressure in the working phase also serves to move lymph fluid in the appropriate direction. The pressure is released during the resting phase, in which the elasticity of the skin moves the therapist's hand passively back to the starting position. In this pressure-free phase, initial lymph vessels absorb tissue fluid from the interstitial spaces. To achieve maximum results, each working phase should last 1 second and should be repeated 5 to 7 times in the same area in either a stationary or a dynamic pattern. It's also performed using light directional pressure. The pressure should be sufficient to stretch the subcutaneous tissue against the underlying fascia to its elastic capacity. It's not necessary to apply high pressure to achieve this goal. In fact, too much pressure could damage anchoring filaments or other lymphatic structures, or cause lymphangiosperm in lymph collectors. The amount of pressure is sometimes described as the pressure applied while stroking a newborn's head. However, more pressure is needed if fibrotic tissue is present. Manual lymph drainage is often called a light touch massage, but it's not massage. The word massage means to knead from the Greek masso massein, using considerable pressure, and is used to treat ailments in muscle tissues, tendons, and ligaments. Manual lymph drainage, on the other hand, consists of very gentle manual techniques designed to have an effect on fluid components and lymphatic structures located in superficial tissues such as the skin and subcutis. Manual lymph drainage can be used to treat various different ailments, but it's also one of the 4 components of complete decongestive therapy, CDT, which is considered the gold standard treatment for lymphedema patients.